So our first vaccines have arrived, 1 million doses that will go to healthcare workers first, most likely around the middle of the month. And the Health Minister says 20 more million doses will be on their way in the coming months as well. But once they are here, vaccinating the 40 million or so South Africans required for population or herd immunity will take some doing. Now, South Africa has experience in large drug rollouts. We run the world's biggest HIV/AIDS treatment program. So will that help us as we ramp up this mass inoculation program for COVID-19? Mark Heywood is the editor of Daily Maverick Citizen, but for many years he was a prominent AIDS activist, challenging the recalcitrant government to end its AIDS denialism and start the HIV drug rollouts. And he joins me now. Hi, Mark. Always great to chat to you. So it's a massive logistical challenge, but at least we don't have a government in denial. We have a government on board, a government that is being absolutely transparent. Are we in a good place at the moment?
Good evening, Sally, and thank you for having me. Yes, I think that the best way to approach this very, very large challenge that we face is to have belief in ourselves and in our capacity to get this vaccine to the 67% of people in South Africa who need it if we are going to save many, many lives and achieve what government and scientists call herd immunity. You know, I heard you drawing parallels with the HIV epidemic, and in many ways the HIV epidemic has helped us to build the institutional platform and has given us the experience that we need, if we can get the parts right, and we can perhaps come back to that, to do this successfully. I mean, you have to bear in mind, Sally, that with HIV, which is a much more complicated virus in many respects, you know, we had to provide, and are providing today, 5 million people with antiretroviral medicines that they have to take every day, every month, every year of their lives. And we have built systems to get those medicines out to our clinics. We've built what we call treatment literacy, so that people who were fearful at one point of taking these medicines have learnt the benefits of the medicines. So I'm not saying that it won't be tough or that it won't be a challenge, but I do believe that we are up to the task.
So how do you think the best way is of going about it? I mean, should we be using, with the healthcare workers, it's fairly easy. They anyway come to hospitals to work, so we can get the vaccine into their arms that way. Should we be using some of the networks that the AIDS treatment program has set up? Is that one way? Another suggestion is that we absolutely have to do this hand in hand with the private sector and government together.
Yes, so in a way that is well coordinated and planned, we have to use every little bit of capacity we have in this country. We have, as you mentioned, organizations, community-based organizations that work on HIV, that work on TB, that work on maternal and child health. They need to be utilized. We have a private healthcare sector. We have workplaces that have workplace health programs. We have schools. We have companies that are able to deliver Coca-Cola and, in bad times, beer to the smallest spaza shop in the farthest part of the country on a daily basis. What it's going to need is effective coordination and planning, because, as everybody knows, there's a shortage of these vaccines. We're not receiving all the vaccines that we need as a country today. So we have to start with prioritization of people who are either most at risk of COVID-19 because of the comorbidities, as we call them, that they have, or people who are most at risk of COVID-19 because, like healthcare workers, on a day-to-day basis, they are putting themselves in danger.
You know, it's one thing to get the vaccines and then have a logistical rollout plan. It's another to convince people that it's safe. And one of the worrying things that we're seeing, even from some of the people that we've spoken to, ordinary people, saying, I'm a little bit frightened, I don't know enough about this vaccine. It's been developed quickly. Plus, of course, there's this massive amount of misinformation about vaccines. So some of the questions that are coming through are, can I have this vaccine if I'm diabetic, if I have cancer, if I'm on AIDS treatment? Is it safe, or will it actually give me COVID-19? Because we know that the way vaccines work, my limited understanding, it's a dead version of the virus that then activates your antibodies. So those are the sorts of concerns that people have.
Yeah, and people's anxieties are understandable, but, I would like, as somebody who has worked in health for 30 years, to try to put those anxieties to rest. These vaccines have not been developed from scratch in 1 year. These vaccines have been developed based upon decades of work with trying to develop vaccines for other types of viruses. They've been developed by our best scientists in South Africa, by our best scientists in the world. They have been very, very carefully analyzed and studied for safety as well as efficacy, their effectiveness, by the best regulatory authorities in the world. And Sally, we are already seeing evidence in countries that have started sooner than us to roll out these vaccines, that these vaccines do work and that they do stop people from getting severe COVID disease, from getting milder COVID disease. So everybody needs to learn about the vaccines, and government and civil society and everybody needs to help people to understand. But I think our starting point has to be trust, has to be assurance, and has to be an understanding that at this moment in time, the only way we can overcome this virus, which is killing so many people, which is causing so much disruption to our social and economic lives, is by beginning a vaccine program at a very, very large scale.
And Mark, it's quite interesting because I remember there was a lot of misinformation about AIDS drugs. And obviously
HIV,
some of those
yes.
drugs do have some serious side effects. And it is, a vaccine by comparison is so completely safe. But it's a similar sort of information issue that has to be addressed. How did you get it right with the AIDS drugs?
Well, we got it right with the AIDS drugs, Sally, by developing programs of what we called AIDS treatment literacy. We, as the Treatment Action Campaign, went into communities. We didn't just tell people, you must take this, you must believe it. We worked with communities to understand the medicines, to understand the way in which the human immunodeficiency virus replicates in people's bodies and how it is that medicines target that virus and stop it from copying itself and therefore stop it from doing damage to the body. And I think that it was through treatment literacy, it was through treating everybody with respect and not talking down to people, that gradually people overcame their fears. And then as more and more people began to take antiretroviral treatment, more and more people with AIDS saw friends and family members and comrades taking the treatment, saw people living instead of dying, and came to believe in the drugs. And there's no shortcut. We have to do the same thing again. We have to have mass-based programs of COVID literacy, of vaccine literacy. And we have to answer the questions. We don't have time tonight, Sally, but you ask good questions. And I can say to listeners that the vaccine is safe for people who take antiretroviral medicines at this moment. It's recommended for people with HIV. It's recommended for people with cancer. And that there are answers to all of these questions accessible through government, through community organizations, if people go out to people that you can trust as having your interests and health at their hearts.
Such a crucially important message, and thank you so much. That was Mark Heywood. He's the editor of Daily Maverick Citizen, also, of course, for many years was a prominent AIDS activist as well.